For Australians with an intellectual disability, going to hospital can be more dangerous than for the rest of us. There's concrete proof tonight that failure by medical staff to listen to, understand or offer equal treatment to the disabled has in some cases caused avoidable death. Tonight, one of the world's leading medical journals is publishing the results of a study showing people with intellectual disabilities are twice as likely to suffer an avoidable death as the rest of us, and the death toll is in the hundreds. Elise Worthington reports.
I still love the horse riding, and she looked forward to the horse riding, and she would have been, well, she was a competent horse rider, got to admit.
Maureen McElquam's life has come to a standstill. She's haunted by the death of her daughter Michelle and tormented by the thought she could have been saved.
They tried to revive her. They couldn't do anything. She passed away a few minutes after.
Michelle had a mild intellectual disability, but nothing held her back.
She danced and sing, that's her favourite. I think made her happy, and actually made the whole house happy.
In May 2009, Michelle became unusually quiet.
I called the local doctor, so he came. He just said she had an ear infection and prescribed antibiotics. I'm very stopped for a minute.
Hours later, Michelle had a seizure and was rushed to Bankstown Hospital. She was agitated and in pain. By midnight, Michelle was sitting on the floor, screaming, holding her ears and rocking back and forth.
They gave her some painkillers for a headache, but that didn't seem to work. And I think it's about 5 hours before we actually saw a doctor. Michelle wasn't talking because her headache, she got worse, and you could see that. And I told her she's not always like that. She talks, she can't talk now. She's sick. She's got a bad headache. Her ears are hurting her.
Michelle was discharged just after 3 in the morning.
She put in a discharge note that she wasn't sick. She had a temper tantrum. And I'd say she doesn't that because she had an intellectual disability. Another thing.
When Maureen refused to leave, the hospital called security. Michelle was sent home in a taxi. By the time they arrived, she could barely walk. 7 hours later, 28-year-old Michelle McElquam stopped breathing at home. An autopsy found she died from meningitis.
I would love to say it was unbelievable in the 21st century, but sadly it is still happening, and it's gut-wrenching to hear those stories of human suffering that could so easily have been avoided.
The coroner found staff at the hospital attributed some of her behaviour to the fact she had an intellectual disability instead of a serious illness. But this case is not isolated. Research released in the journal BMJ Open today reveals a disturbing pattern of unnecessary deaths in the Australian health system.
We found that 1 in 3 deaths in people with intellectual disability was from a potentially avoidable cause. We accept that even in the highest quality healthcare systems, there will be deaths from potentially avoidable causes. But the reality here is that the proportion of deaths from potentially avoidable causes was over double that seen in the general population. So we feel that this is quite a significant marker of a major health inequality.
The study found people with an intellectual disability also had an average life expectancy of just 54.
We know that government policy and services development for this group is sadly lacking. People with intellectual disability experience a large range of potential risk factors for early death. These include things like cardiometabolic risk factors, high blood pressure, high cholesterol, obesity.
Erin Sheehy has Down syndrome and an intellectual disability.
Do you think that's enough for that one? Yeah? All right, so start on the next one.
She comes to this program 5 days a week in Sydney's West.
Okay,
Yeah, I think so.
Erin and her mum Christine are preparing for a big birthday.
Oh, yeah, I'm to stay here.
Oh, for your birthday?
Yeah.
You wanted to stay for 3 days?
Yeah.
Wow. We'll have to talk about that.
Yeah, please.
It'll be a big birthday if they want 3 days off.
I want to. This is not good.
But Erin almost didn't make it to celebrate this birthday. She suffered from a major stroke at 25, which left her paralysed and unable to speak.
It came completely out of the blue and was not connected to her condition at all. And it happened in the middle of the night.
Oh, 61.
She was in great pain, and it became clear by the morning that she had lost her memory, complete memory of everything. She became paralysed. She couldn't swallow.
Within 3 days, the doctor ordered she be discharged.
And this man had said to us, "You can take her home. We've got her pain under control." And I said, "But she can't do anything." And his words to me were, "Look, she has Down syndrome. How hard are you going to try?" And I was shocked by that. Physically, I felt like I'd been punched because I just knew this man had made a social decision rather than a medical decision. And that was wrong.
Some of it's about training and skills, health professionals just not knowing how to accurately diagnose and treat people with intellectual disability. I mean, it can be hard because a lot of people with intellectual disability have very limited verbal communication.
Specialised healthcare for people with an intellectual disability does exist in Australia, but in very limited areas.
We know that there are isolated pockets of specialised health services for people with intellectual disability that have been trialled in different states, but there is no systematic response by government at a Commonwealth or state-by-state level in this regard.
Researchers say, at the very least, a national system to monitor deaths and better training for healthcare workers is urgently needed.
And if something doesn't change, more people are going to die, and young people are going to die.
The coronial inquest into Michelle Mackelquam's death made 11 recommendations, which the hospital says it's fully implemented. But advocates say there's inconsistency in hospitals around Australia.
There's just no way that it should be potluck about whether a person with intellectual disability gets decent health care, potluck about whether they live or die.
Bye. I sometimes truthfully have nightmares that if Erin had gone to a nursing home, she could have contracted pneumonia or something, or some other health episode would have occurred to her, and we might not have her now.
Christine stood her ground. She insisted on the standard rehabilitation available to other patients, and after months of care, Erin improved.
She's a vibrant young woman with things to do, places to go, and
People to see.
people to see.
Elise Worthington with that report.